Now, this is basics of psychiatry. Now, the term psychiatry was coined by Johann Christian Riehl. History taking is the first component in psychiatry, similar to other medicinal branches. नाउ देर इज सम इन्फॉर्मेंट. जो पेशेंट होता है ना, उसके साथ एक इन्फॉर्मेंट आता है, उसका साथी, उसके फैमिली वाला कोई बंदा या उसका दोस्त, कोई भी बंदा जो उसके बारे में इंफॉर्मेशन देता है. मोस्ट साइकेट्री पेशेंट्स आर नॉट एबल टू टेल देयर कंप्लेंट्स, सो रोल ऑफ इन्फॉर्मेंट इज़ वेरी क्रूशियल इन दीज केसेस. इन्फॉर्मेंट कैन बी फ्रेंड, फैमिली मेम्बर, स्पाउस, मदर, father, son, or daughter. Someone who knows the symptoms of the patient in detail and he helps to reach the diagnosis. Not every person can be an informant. Informant should be reliable. ऐसा नहीं होना चाहिए कि इन्फॉर्मेंट दुश्मन हो पेशेंट का, वो कुछ अपने हिसाब से ही इंफॉर्मेशन दे. रिलायबिलिटी कैसे डिसाइड करते हैं इन्फॉर्मेंट की कि वो रिलायबल है या नहीं है? वो कंसिस्टेंसी होनी चाहिए उसकी इन्फॉर्मेशन में. The history given by the informant should be exactly same in all interviews, consistent in all interviews. For example, when information of the patient is taken from his father, the information given by father should be same in second interview, consistency. Coherence. The information provided should be logically connected to each other. First half of the information should be connected to the other half. ठीक है, coherence. Chronological information. The information should be provided in a proper, timely manner. For example, how did the symptoms start? Where were the symptoms in the beginning? How the symptoms progressed over time, etc. Closeness with the patient. Informant should be close to the patient and must be aware of the patient's symptoms. For example, if the informant who came with the patient is living in another city, she is not a reliable informant. And he should have a concern with the patient. Like informant should be genuinely concerned for the welfare, for the well-being of the patient. This is important in medico-legal cases. For example, wife who has filed a case against her husband is not a reliable informant for him. If all the 5 C's are fulfilled, then we consider informant as reliable. Consistency, coherence, closeness. ठीक है, 3 C हो गए. Fourth is chronological information, and fifth is concern. Adequacy of information. Whether or not if the history given by the informant or patient is enough to reach a diagnosis, that is called as adequacy. Now history is done. Mental status examination. Clinical examination in psychiatry. Signs and symptoms of psychiatric disorders of patients are recorded. Components होते हैं 5. General appearance and behavior. स्पीच, पहले उसको देखेंगे, फिर उसको सुनेंगे, फिर उसके मूड को देखेंगे, इफेक्ट को देखेंगे, फिर उसके परसेप्शन को देखेंगे, थॉट को देखेंगे. परसेप्शन एंड थॉट, मूड एंड इफेक्ट, स्पीच, जनरल अपीयरेंस एंड बिहेवियर. General appearance and behavior. Just by seeing the appearance and observing the appearance and behavior of the patient, we can get clues about psychiatric disorder. For example, patient comes to OPD and he is wearing a pink shirt, orange pants, goggles, hat, wearing lot of makeup. This appearance itself gives a clue that this patient probably has manic symptoms. Now speech. If a patient comes to OPD and he is speaking very rapidly or copious amount and it's not possible to interrupt the speech, is possibly suggesting towards mania. In mania, speech volume gets increased, tone gets increased. Mood and affect. Mood and affect, what's the difference? Mood is long term or longitudinal emotional state. Affect is short term or cross sectional emotional state. Mood is felt inwards. Affect is expressed outwards. Mood describes internal emotional state. Affect is external expression of that mood. Mood is, for example, I was sitting sad for 1 month, but today I am smiling. In this case, my mood is sad and my affect is happy, smiling at this particular point of time. Affect, if I am smiling, expression of smile means I am happy. Smile is an external expression of emotions, would be called as an affect. It is an external expression, as you can also observe it. Thirdly, it is what I do in a cross-sectional manner. Both these terms refer to emotions. Affect and mood are described under various subheadings like quality of mood, fluctuation in the mood, and appropriateness of the mood and congruence of the mood. Quality से क्या समझते हैं? Quality of the mood, predominant emotional state at particular point of time. For example, patient may be happy, so the quality of the mood is happy or sad or angry, irritated or bored. Affect and mood are different terms but often are used interchangeably. अब नॉर्मेलिटीज़ क्या हो सकते हैं क्वालिटी में? मूड अगर बहुत एलिवेटेड है, डिस्फोरिया है, डिप्रेस्ड मूड है, दैट इज़ द क्वालिटी ऑफ मूड दैट इज़ अब नॉर्मल, डिप्रेस्ड, डिस्फोरिया एंड एलिवेशन. एलिवेशन ऑफ मूड में यूफोरिया हो सकता है, इलेशन हो सकता है, एक्सोल्टेशन हो सकता है, एक्सटेसी हो सकता है. ठीक है, ये होते हैं एलिवेशन ऑफ मूड, अब नॉर्मल क्वालिटी ऑफ मूड. यूफोरिया में क्या होता है? स्टेट ऑफ एक्सट्रीम हैप्पीनेस विदाउट एनी रीज़न. फॉर एग्जाम्पल, एक्सट्रीम हैप्पीनेस व्हेन फेल्ड इन एन एग्जाम विदाउट एनी रीज़न. फेल हो गया फिर भी हैप्पी है, यूफोरिया. एक्सट्रीम हैप्पीनेस ऑन गेटिंग रैंक 1 इन एन एग्जाम इज़ नॉट यूफोरिया. ठीक है, रैंक 1 लाने पे जो हैप्पीनेस है, एक्सट्रीम हैप्पीनेस है, वो यूफोरिया नहीं है. फेल हो जाने पे एक्सट्रीम हैप्पीनेस है, दैट इज़ यूफोरिया. यूफोरिया इज सीन इन मेनिया और हाइपोमेनिया. What is elation? It is one step higher to euphoria. It is euphoria plus psychomotor activity seen in mania. Patient is happy and running and jumping. ठीक है, psychomotor activity आ गई है, then it is elation. Exaltation क्या है? euphoria है, साथ में psychomotor activity है, साथ में delusion of grandiosity है. The patient thinks he is the richest man on earth. उसके साथ वो jump कर रहा है, खुश है बहुत ज़्यादा, extreme happy, और वो delusion है उसको कि वो अलग ही कुछ है दुनिया में. ठीक है, लाइक ही इज़ द रिचेस्ट. तो एक्सोल्टेशन में डिल्यूजन आ जाता है, इलेशन में साइकोमोटर एक्टिविटी, यूफोरिया में एक्सट्रीम हैप्पीनेस विदाउट एनी रीज़न. एक्सटेसी में स्टेट ऑफ एक्सट्रीम हैप्पीनेस, एपिटोम ऑफ हैप्पीनेस, सेंस ऑफ ब्लिस सीन इन पीपल हु मेडिटेट. ठीक है, ऑल दीज abnormalities आर सीन इन पेशेंट्स विद मेनिया और हाइपोमेनिया. नाउ सम इम्पॉर्टेंट इन्फॉर्मेशन. साइकोमोटर एक्टिविटी इज चेंज इन मोटर एक्टिविटी ड्यू टू साइकोलॉजिकल रीजन्स. ठीक है, मोटर एक्टिविटी में चेंज हो जाना ड्यू टू साइकोलॉजिकल रीजंस, उसको बोलते हैं साइकोमोटर एक्टिविटी. अब डिस्फोरिया, प्रीडोमिनेंट मूड स्टेट इज इरिटेबिलिटी. फॉर एग्जांपल, द पेशेंट गेट्स एंग्री एंड इरिटेटेड एट वेरी स्मॉल थिंग्स. डिस्फोरिया इज ऑल्सो सीन इन पेशेंट्स विद मेनिया. डिप्रेस्ड मूड, परसिस्टेंट और परवेजिव सैडनेस. परवेजिव मीन्स इन ऑल द डोमेन्स ऑफ लाइफ, हर चीज़ में उदासी, परवेजिव. Whether patient is playing, reading or watching TV, depressed mood is present. Persistent है, sadness is present all the time. Depressed mood is seen in depression. Now mood में हमने क्वालिटी देख ली. ठीक है, ऊपर नीचे होना मूड का. एलिवेशन में यूफोरिया, इलेशन, एक्साल्टेशन, एक्सटेसी, और नीचे जाने में हमने देख लिया डिस्फोरिया एंड डिप्रेशन. अब है फ्लक्चुएशंस, उसके बाद देखेंगे अप्रोप्रिएटनेस एंड कॉन्ग्रुएंस. फ्लक्चुएशन में क्या है? नॉर्मली देर इज सम लेवल ऑफ फ्लक्चुएशन इन अफेक्ट एंड मूड. नॉर्मली होता है फ्लक्चुएट हमारा मूड. एग्जाम्पल ऑफ नॉर्मल फ्लक्चुएशन इज हैप्पी इन द मॉर्निंग बट सैड आफ्टर चेकिंग पुअर परफॉर्मेंस इन एग्जाम एंड ऑन फाइंडिंग सिली मिस्टेक्स, बिकमिंग इरिटेबल. इन सर्टेन साइकेट्रिक डिसऑर्डर पैथोलॉजिकल फ्लक्चुएशंस आर सीन. पैथोलॉजिकल फ्लक्चुएशंस, example of pathological fluctuation is at one point of time patient is smiling, giggling, and all of a sudden he starts crying without any reason, from too happy to too sad. That is a abnormal fluctuation of mood, and this is called as labile or unstable mood or emotional lability. Emotional instability, emotions are unstable. For example, a man comes to your OPD, he is laughing at one moment and crying at another moment, seen in patient with mania. Another thing is affective flattening or flat affect or emotional blunting or blunt affect. इसमें क्या होता है? एग्जैक्ट अपोजिट है ये लेबाइल अनस्टेबल मूड का. एग्जाम्पल, तुमने एक जोक मारा, पेशेंट हंसा ही नहीं. तुमने पेशेंट को थप्पड़ मारा, पेशेंट को गुस्सा ही नहीं आया. मतलब मूड बिल्कुल फ्लैट हो गया है ना, फ्लक्चुएशन हो ही नहीं रही. ठीक है, ब्लंट हो गया, बिल्कुल इमोशनली ब्लंट. एंड इट इज़ सीन इन स्किज़ोफ्रेनिया. ठीक है, मेनिया में दिखता है फ्लक्चुएशंस ऑफ मूड, अब नॉर्मल फ्लक्चुएशन, और ब्लंटिंग दिखती है स्किज़ोफ्रेनिया में. देयर इज ऑल्सो डिफरेंस बिटवीन फ्लैट अफेक्ट एंड ब्लंट अफेक्ट बेस्ड ऑन रेंज, बट स्टिल दे आर कंसिडर्ड सिमिलर. नाउ appropriateness and congruence. Appropriateness means whether my emotional state is matching or in sync with the external environment or not. If it is in sync, then it's called as affect. is in the appropriate state. If it is not in the sync, then it is called as inappropriate affect. Example, I go to a birthday party, social situation, and I am happy in this situation. Then affect is in appropriate state. I go to a birthday party, social situation, and I am crying, saying why this man is still alive, and in this situation, affect is in inappropriate state. I go to a funeral, social situation, and I am laughing. That is an inappropriate affect. What is congruence? Congruence is more of an internal comparison, whether my emotions are matching with my thought content or not. What I am thinking, what I am speaking, and how I am appearing emotionally, whether it is matching or not. Example, a patient comes to you is describing how his mother died. The thought content is about death of his mother. If his emotional state while describing this is sadness, this is congruent mood or affect. If the patient is laughing, giggling while describing about the death of his mother, then it is called as incongruent mood. तो कॉन्ग्रुएंसी होती है कि अपने खुद के विचार से में आप मूड जो है आपका वो अप्रोप्रिएट है या नहीं है, और अप्रोप्रिएटनेस होती है कि आप बाहर की सिचुएशंस के साथ, एनवायरनमेंट के साथ आप अप्रोप्रिएट मूड शो कर रहे हो या नहीं कर रहे हो. नाउ alexithymia. What is alexithymia? Now, inappropriate and incongruent effects are features of schizophrenia. Alexithymia. Alexithymia is inability to understand emotions of other people and inability to express your own emotions. ना दूसरों के इमोशंस को समझ पाना और ना अपने इमोशंस को एक्सप्रेस कर पाना, उसको बोलते हैं alexithymia. Sometimes we confuse alexithymia with affective flattening. But in affective flattening, the patient does not feel anything. That is, the patient does not have emotions. That is affective flattening. But in alexithymia, the patient does have emotions, but he is not able to express them. Sometimes we also say alexithymia is lack of words to describe emotions. So alexi मतलब एलेक्सा के इमोशंस नहीं है, ये समझ सकते हैं. एलेक्सा अपने इमोशंस नहीं बता पा रही, ठीक है. तो एलेक्सीथाइमिया. एनहिडोनिया. एनहिडोनिया इज इनएबिलिटी टू फील प्लेजर इन प्रीवियसली प्लेजरेबल एक्टिविटीज. Things which used to make happy in past no longer making happy. Example, watching cricket used to make me happy. Going on dates used to make me happy. Now nothing makes me happy. That is anhedonia. Feature of depression can also be seen in schizophrenia. Part of brain involved in generation of emotions is limbic system, hippocampus, amygdala, hypothalamus, cingulate gyrus, and related thalamic and cortical areas. Part of brain which is involved in regulation or control of emotions is frontal lobe. Example, I remembered a joke in my lecture theatre, but I controlled myself and didn't laugh. This control was due to regulatory area by frontal lobe. Now examination में the fourth thing is perception. Mood and affect was the third thing. Speech was the second, and general appearance and behavior was the first. Perception is the fourth. Fourth component of mental status examination. Large number of psychiatric abnormalities present with perception abnormality. Any information coming through a sensory organ is defined as perception. Important information. There are 5 basic types of perception: auditory perception, visual perception, olfactory perception, gustatory perception, and tactile perception. Abnormalities of perception. Example and diagnosis. Patient sees a black pen while looking at a black pen. This is normal perception. Patient sees a black umbrella while looking at a black pen. This is abnormal perception. False perception of a real object or stimulus. This is example of illusion. Illusion हो रहा है, मतलब कि कुछ का कुछ दिख रहा है, कुछ का कुछ दिख रहा है कुछ और दिख कुछ हो रहा है. This is illusion, abnormal perception. Patient sees a black umbrella while looking at nothing. कुछ है ही नहीं फिर भी umbrella दिख रहा है. This is abnormal perception. False perception in the absence of any object or stimulus. This is example of hallucination. A man walking down the lane, he is frightened by a snake on the road, which was just a rope. This is known as illusion. Criterions of hallucination. Occurs in absence of any object or stimulus, are as vivid, detailed and clear as a real perception. बहुत clear और detailed होते हैं hallucination. For example, when asked to describe about a real person, we say that person is wearing a white shirt, he was wearing a mic, he was wearing a grey blazer, he was wearing a spectacle. All these details are suggestive of vividity. Similarly, hallucinations are so vivid that the person who is having it is not able to differentiate between what is hallucination and what is reality. Example, a patient comes in OPD and says, I see a man standing next to me. He is 6 feet tall, wearing a white shirt, black pant, a hat, black goggles, and a bow tie. All these things show that perception is vivid, clear, ठीक है, detailed. It is hallucination as the person is not actually present there. Example: a patient comes in OPD and describes a man standing next to him, and describes that I see a couple of dots, and these looks like a face, and he says he can't see anything more. In this case, whatever the patient is seeing is not vivid, so it's not a case of hallucination. Hallucination हमेशा क्लियर कट होती है, डिटेल्ड विविड होती है, साफ साफ दिखती है बिल्कुल. लेकिन अगर कुछ कुछ अंदाजा से बता रहा है पेशेंट, तो वो हेलुसिनेशन नहीं है, कुछ और हो सकता है. हेलुसिनेशन अकर इन आउटर एंड ऑब्जेक्टिव स्पेस, एनीथिंग आउटसाइड द बॉडी. For example, hearing voices from outside. If the patient say, I can see Deepika Padukone with closed eyes, so her inside the mind, inner and subjective space, then it is not a hallucination. Hallucination हमेशा बाहर दिखती है, बाहर से सुनाई देती है, बाहर से कोई टच करता है. Hallucination is from outside. अगर वो आंख बंद करके कुछ देख पा रहा है, मतलब वो अंदर सब्जेक्टिवली सोच रहा है, सब्जेक्टिवली उसको दिख रही है, इनर एंड सब्जेक्टिव स्पेस में, वो हेलुसिनेशन नहीं होगी. And hallucinations are not under voluntary willful control. Example: patient says, I can hear voices which are not under my control, cannot start it, cannot stop it. Voices start on their own, stop on their own. Example: patient says, I can see Deepika Padukone when I close my eyes, and this ability is under my control. When I open my eyes, she disappears. This is not hallucination. If first, second, fourth criteria get fulfilled, but third criteria is not fulfilled, which means instead of occurring in outer and objective space, the perception is occurring in inner and subjective space. This is known as pseudo hallucination. Pseudo hallucination तब होगी जब वो involuntarily हो रही है, अपने मन से नहीं हो रही, अपने आप हो रही है वो hallucination, ठीक है, और vivid है, बिल्कुल clear है, और बिना किसी actual stimulus से हो रही है, लेकिन inner और subjective space में हो रही है, तो वो pseudo hallucination है. Now the patient says, I hear some voices which nobody else hears it. Even people sitting next to me are not able to hear it. On taking history, he says, only he is able to hear it. Criteria 1 is fulfilled. The voices are clear. Voices are of a middle-aged woman. She keeps on talking to me. Criteria 2 is fulfilled. These voices are coming from my mind. Criteria 3 is not fulfilled. I cannot start or stop the voices. Criteria 4 is fulfilled. Pseudo hallucination. Hallucinations are in outer and objective space. Pseudo hallucinations are in inner and subjective space. Psychiatric disorder is classified into two broader classifications. Psychiatric disorder को दो broader classification में classify किया गया है: organic disorders and functional disorders. Organic disorders are the disorders in which brain parenchyma is involved, like tumors, stroke, delirium, dementia, etc. These are disorders of the brain tissue. ठीक है. Functional disorders, no abnormality is found in the brain parenchyma on MRI, CT scan, etc. So these are disorders of mind. ठीक है. Example: schizophrenia. Important information: most common hallucination overall is auditory hallucination. Now the most common hallucination overall is auditory hallucination. Most common hallucination associated with functional disorders is auditory hallucination. Most common hallucination associated with organic mental disorders is visual hallucination. तो most common auditory होती है, functional के साथ भी auditory होती है, लेकिन organic अगर brain में कोई problem है, organic tissue disorder है, तो visual hallucination होती है commonly. Cocaine intoxication is associated with tactile hallucination. Olfactory and gustatory hallucinations are typically associated with which lobe? Temporal lobe. Olfactory यानी smell, gustatory यानी taste, temporal lobe. In temporal lobe epilepsy, all types of hallucinations are seen. सारी तरह की temporal lobe में. Schizophrenia में सब type की hallucinations are seen. ठीक है. Schizophrenia में सब सारी hallucination, temporal lobe epilepsy में सारी hallucination. ठीक है. ऑल्फैक्टरी का स्टेटरी टेम्पोरल लोब, कोकेन में टेक्टाइल, ऑर्गेनिक में विजुअल, फंक्शनल में ऑडिटरी, मोस्ट कॉमन ओवरऑल ऑडिटरी. स्पेसिफिक हैलुसिनेशंस: हिप्नागोगिक हैलुसिनेशन, जब सोते वक्त सोने जा रहा था उस टाइम पे हैलुसिनेशन हो रही है तो हिप्नागोगिक हैलुसिनेशन है. हिप्नोपोम्पिक हैलुसिनेशन व्हाइल गेटिंग अप फ्रॉम स्लीप, हिप्नोपोम्पिक. hypnagogic. Both are features of narcolepsy. ठीक है, ज़्यादा नींद आना, उस केस में hypnagogic and hypnopompic hallucination. Reflex hallucinations. Stimulus in one modality produces hallucinations in another modality. Like modality refers to olfactory, auditory, visual, gustatory, etc. तो स्टिमुलस एक मोडालिटी में है, हेलुसिनेशन दूसरी मोडालिटी में हो रहा है. एग्जाम्पल, पेशेंट सेज व्हेनेवर सी अ ट्यूब लाइट आई स्टार्ट हियरिंग वॉइसेस ऑफ दीपिका पादुकोण. Stimulus is in visual modality, whereas hallucination is in the auditory modality. Diagnosis is reflex hallucination. This is a morbid variety of synesthesia. Synesthesia means combination of sensations seen in cannabis and lysergic acid diethylamide intoxication. Lysergic acid diethylamide, LSD intoxication, cannabis intoxication, उसमें synesthesia होता है, combination of sensations. उसी की morbid variety है reflex hallucination. Now in reflex hallucination we are not fulfilling the first criteria, that is absence of stimulus. इसमें stimulus है, so reflex hallucination is an exception to the first criteria for hallucination. A young boy comes to your OPD and says he can hear lights and he can see music. What is the abnormality? Reflex hallucination. Patient complains of crisscross of perception. What is the abnormality? Reflex hallucination. Crisscross of perception. Functional hallucination. Stimulus in one modality produces hallucinations in the same modality. ठीक है, उसको बोलेंगे functional hallucination. Example, patient says whenever I hear noise of air conditioner, I also start hearing voice of Deepika Padukone. Now the stimulus is also in the same modality, but a different stimulus than what is perceived. ठीक है, so stimulus in one modality produces hallucinations in the same modality but different perception. ठीक है, तो functional hallucination उसको बोलेंगे. In this case, stimulus is in auditory modality and hallucination is also in auditory modality. How is functional hallucination different from illusion? Illusion में object is itself perceived in the wrong manner, but in functional hallucination, object is perceived the way it is, and along with another object which is not present there, that is also perceived. Illusion में example, the patient sees only a black umbrella when he looked at a black pen. But in functional hallucination, the patient sees both black pen and black umbrella while looking at a black pen. ठीक है. Now the some keywords are lysergic acid diethylamide, LSD, intoxication, cannabis, synesthesia. Morbid variety is reflex hallucination. Functional hallucination is same modality, stimulus and perception. Both of them are seen. And hypnagogic, hypnopompic, narcolepsy. Now, which of the following statement about hallucinations is false? They are perceived as not real. No, they are perceived as real. They appear to be coming from external world. Yes. Sensory organs are not involved. They are involved. No, sensory organs are not involved. Pseudo hallucinations are described as being perceived by mind's eye. Mind's eye. थॉट और कॉग्निशन, ये देखेंगे हम अगली वीडियो में. थॉट और कॉग्निशन ये इसी में कर लेते हैं. ठीक है, थॉट और कॉग्निशन विच इज द फिफ्थ मोस्ट इंपॉर्टेंट कंपोनेंट ऑफ एमएसई. ऑल द मेंटल प्रोसेस दैट हेल्प्स इन एक्वायरिंग इन्फॉर्मेशन, ऑल ऑफ देम आर पुट टुगेदर अंडर ब्रॉडर टर्म कॉग्निशन. थॉट प्रोसेसेस. ठीक है, all the mental process that helps in acquiring the information, cognition. The term cognition and thought are often used interchangeably. Thought is something which I know of. Perception is occurring at that point of time. There is a blackboard behind my back. Is it a thought or a perception? It is a thought. I turn behind towards the board and say, there is a blackboard. Is that a thought or a perception? It's a perception. India Gate is in the Delhi. Is it a thought or perception? It is thought. Gateway of India is in Mumbai. Is it a thought or a perception? It is a thought. Characteristics of thought. Stream or flow of thoughts. Speed by which thoughts come to your mind. That is called as stream or flow. Continuity of thinking. Example, my name is Praveen Tripathi. I did my MBBS and MD from Delhi Currently, I am working as a psychiatrist in Delhi. Is this normal stream of thought? Yes. Abnormalities of stream of thought is flight of ideas, increased speed of thinking. Connection between the thoughts appears to be due to chance factors such as rhyming. Mind does not have time to properly connect or organize the thoughts. Example, I live in Delhi, my cat has a big belly, I love eating jelly, Ellie is Ellie. ठीक है, usually a feature of mania. Inhibition or slowed thinking. Thoughts come slowly and progresses with a slow rate. It's kind of reverse flight of ideas, seen in depression. Apart from these two, other main abnormalities of stream of thoughts are circumstantiality, perseveration, and thought block. These three abnormalities can be characterized in both stream of thoughts and form of thoughts. According to Fish's psychopathology, these three are disorders of stream of thoughts. Later, psychiatrist named Nancy Anderson wrote a landmark article in which she included these three disorders as form of thoughts. This is widely followed now. All of the statements are true about thought except perseveration is out of context repetition. Perseveration is out of context repetition. Yes, it is true. Circumstantiality is over inclusion of irrelevant details while getting back to the original point. Yes, it is true. Verbigration is senseless repetition. Yes, it is true. Vorbe is skirting around the end point but never reaching it. Yes. Loosening of association is logically connected thoughts with loss of goal. No. Form of thought refers to organization of thinking or association between thoughts. Example, thought 1, my name is Praveen and I am a doctor. Thought 2 is I live in Delhi. Thought 1 has got two components. My name is Praveen is component A and I am a doctor is component B. In this case, the thought A is meaningfully connected to thought B and thought 1 is meaningfully connected to thought 2. So this is a well organized thought, that is form of thought is normal. Any abnormality in form of thoughts is known as formal thought disorders, characteristic abnormality in schizophrenia. Types of formal thought disorder: derailment, loss of association between successive thoughts. For example, my name is Praveen, Beijing is the capital of China, so I have derailed from the previous thought. Loosening of association, loss of connection between components of same thought. For example, my name is Praveen and it is going to be the biggest blockbuster of this year. ठीक है, सो कनेक्शन नहीं है, एक ही थॉट में के कंपोनेंट्स में कनेक्शन नहीं है. Derailment is two thoughts, association loss between two successive thoughts. Loosening of association is एक ही थॉट के अंदर के कंपोनेंट्स के बीच में कनेक्शन ना होना. Incoherence, word salad, complete loss of organization, no meanings get conveyed. फॉर एग्जाम्पल, द पेशेंट सेज माई प्रवीण ओके चाइना बाय. ठीक है, यह है इनकोहेरेंस, वर्ड सैलेड. सर्कमस्टेंशियलिटी, थॉट प्रोग्रेसेस विद इंक्लूजन ऑफ अननेसेसरी डिटेल्स आ जाती हैं. ठीक है, द गोल ऑफ द थॉट इज रीच्ड. एग्जाम्पल, इन विच ब्रांच यू वॉन्ट टू डू PG, इफ द आंसर इज मेडिसिन. दिस इज द नॉर्मल वे ऑफ थिंकिंग. गोल ऑफ द थॉट इज रीच्ड इमीडिएटली. बट अब नॉर्मली, in which branch you want to do PG, if the answer is in first year I used to like anatomy, by the time I reached the second year I started liking pathology, in the third year the SR of ophthalmology was very pretty, so I also started liking ophthalmology. In the final year I started liking surgery. Now I think after finishing my internship I will do my job. With job I will earn some money. With money I will get married, and once I get married, I will use the salary to buy a seat of medicine. Now in this case, the patient is telling unnecessary details, but he finally replies the correct answer. This is abnormal way of thinking. Finally, the goal of the thought is reached. This is circumstantiality. What is tangentiality? Thought is related to goal in a distant way, but the goal is never reached. So tangent से होके निकल जा रहा है. Example, psychiatrist says, who is your favorite actress? Patient says, sir, Bollywood is based in Mumbai. Bollywood movies are mostly based on relationship. Hollywood is in Los Angeles, California. Hollywood movies are more action packed. My uncle also lives in Los Angeles, California. In this case, the thought is related to the goal. Related to the goal. but the goal is never reached. That is tangentiality. Neologism. Neo means new, logism means word. So the patient coins new words. The patient creates a new word whose derivation cannot be understood. Example, a patient holding pen says it is Tintin Tapa. ठीक है, amongst formal thought disorder neologism is specifically related to schizophrenia. हाई प्रोडक्टिव वैल्यू है. अगर नियोलॉजिज्म है पेशेंट में तो स्किज़ोफ्रेनिया ही होगा. इट हैज़ अ हाई प्रोडक्टिव वैल्यू. नियोलॉजिज्म इज़ अ रेयर फाइंडिंग, रेयर ही फाइंडिंग होती है, इसलिए स्किज़ोफ्रेनिया में ही पाया जाता है. मेटोनिम्स, वर्ड अप्रोक्सीमेशंस. So metonyms means word approximations. Old words are used in unconventional or strange way. Example, a patient holding pen says that it is a presentation regulator mechanism. ठीक है, तो it is true that it is a presentation regulator mechanism, but it is an unconventional way of saying this. In this case, patient uses a strange word, but still we can understand what he is trying to convey. But if he calls it Tintin Tapa, then it is not understood. Then it is neologism. But if he use an unconventional strange way, then it is metonym. Word approximations. Clanging or clang associations. Words are associated with each other as they sound similar, and there may be lack of any meaningful connection. Example, I make sense out of nonsense, and nonsense is the essence of turbulence of life. In this case, words are all connected because they sound similar, but otherwise they are not connected meaningfully. Clang associations are seen in patients with flight of ideas. Perseveration. Perseveration can also be classified as disorder of stream of thought, repetition of the same response beyond point of relevance. Example, psychiatrist asks, "What is your name?" Patient says, "Ramesh Singh." "What is your father's name?" "Ramesh Singh." Where do you stay?" "Ramesh Singh." "Who is the president of India?" "Ramesh Singh." In this case, the patient is repeating the same response beyond a point of relevance, and it is also suggestive of organic brain damage, brain parenchyma damage. Thought blocking. Thought blocking can also be described as a disorder of stream of thought. Sudden arrest of train of thoughts, leaving a blank, no thoughts for a period of time, that is called as thought blocking. Which of the following is a formal thought disorder? Derailment, yes. Content of thought, what are you thinking about? And इसमें आता है delusion. Delusions are false belief, but all false beliefs are not delusions. There are 3 steps to diagnose delusions. It has to be a false belief, it has to be a firm, fixed, and unshakable belief which continues despite evidence against it, and it is unexplained by his social or cultural background or his religious background. False, firm, fixed, unshakable belief which continues despite evidence against it, unexplained by social or cultural background. For example, there is a case patient says, "I look better than Ranbir Kapoor." This is a false belief. Now psychiatrist now brings a mirror and a photograph of Ranbir Kapoor and asks him to compare. Now there is evidence that evidence was given to break the false belief, and the patient again says, "Yes, I look better than Ranbir Kapoor." Patient refused the evidence. Now this is a firm, fixed, unshakable belief. Can we call it delusion at this step? No, because he might belong to a village where people actually think that the patient is better than Ranbir Kapoor. So, in the third step, we check whether the belief of the patient can be explained by his background. In third step, we go to his village and bring 2-3 villagers and ask them, "Does the patient look better than Ranbir Kapoor?" If villagers say Ranbir Kapoor is better, but the patient denies it, yes, now it is a delusion unexplained by social cultural background. Now there is case 2. Patient comes from tribal area and says, "I have developed tuberculosis because somebody did black magic on me." It is not labeled as delusion because it is possible that patient where he belongs to believe in black magic can cause illness. Since it is explained by social and cultural background, so it is not a delusion, it is considered as superstition. Types of delusion. Delusion of persecution. In delusion of persecution, patient believes that someone wants to harm him. Example, patient says, "The police are following me. The intelligence agency is after me. My neighbors are trying to hatch a conspiracy against me. My family members want to kill me and take away my property, etc. Most common delusion overall is delusion of persecution. Most common delusion in schizophrenia is also delusion of persecution. Delusion of reference. Patient believes that neutral stimuli are somehow related to him. Example, patient says, Doctor, the tube light in your room has a camera fitted which is recording me. Patient is walking down the road, he sees two people talking and says that they are talking about me. Patient sees someone smiling and says that she is laughing at me. So he thinks everything is about him. So this is delusion of reference, that everything is referring to him. Delusion of grandeur or delusion of grandiosity. Patient believes that he has some special power or role or identity. For example, patient says, I am so powerful that I can push train with my bare hands. Or he says that I have been sent by God to spread peace and humanity. Or he says that I am the reincarnation of God. This is delusion of grandeur or grandiosity, seen in mania and schizophrenia. Delusion of love, erotomania, Clarembolt syndrome or fantasy lover syndrome. Erotomania, Clarembolt syndrome or fantasy lover syndrome. Patient believes that someone from higher socio-economic class is in love with him or the patient. Example, Katrina Kaif broke up with Ranveer Kapoor because she is in love with me. Doctor says, have you met her? Patient says, no, but I know she loves me. Doctor says, how do you know it? Patient says, she sends love letters to me. Doctor says, have you received any letters? Patient says, no, I haven't received any letters because when she sends the letter, Ranveer Kapoor intercepts those letters and never allows those letters to reach me. But she loves me, that is for sure. So that is delusion of love. Delusion of infidelity, morbidly jealous or pathologically jealousy or Othello syndrome. Othello syndrome, seen in patients with alcohol dependence. Patient says, my girlfriend is cheating on me, my wife is cheating on me, my husband is cheating on me, etc. Delusion of guilt. Patient feels guilty and the guilt is at the delusional level. Even if you try to convince the patient, he doesn't accept it. Example, a case that patient came to OPD with history of depression and she also said that she has been a mad mother. But her children denied and said that she was a wonderful mother and all of them are well settled, and from past 4 or 5 months she is saying these things a lot, that she is a bad mother. Diagnosis is delusion of guilt, usually seen in patients with severe depression. Nihilistic delusion, delusion of negation or Cotard syndrome. So हमने ओथेलो syndrome देखा, infidelity, Cotard syndrome, nihilistic, D. Clarembolt syndrome, delusion of love. Nihilistic delusion, delusion of negation or Cotard syndrome. Patient may deny existence of their body, their mind or world in general. Term nihilism means nil. Patient says things have ended. Everybody is dead in the world. The wind has stopped blowing. Earth has stopped rotating. All my internal organs are rotten, etc. Usually seen in patients with depression. Delusion of enormity. Patient believes that their action will cause a catastrophe. Sometimes the patient with delusion of negation also develops delusion of enormity. For example, patient says, I cannot urinate because if I urinate, there will be floods all around the world. If I sneeze, the world will blow away, etc. These are delusion of enormity. Delusion of misidentification syndrome. Doubt is on the identity of individual, presented in four ways: Capgras syndrome, Frigoli syndrome, syndrome of subjective doubles, and syndrome of intermetamorphosis. So, delusion of misidentification or misidentification syndrome, doubt is on the identity of the individual, presented in four ways: Capgras syndrome, Frigoli syndrome, syndrome of subjective doubles, and syndrome of intermetamorphosis. हम इनको एक एक करके देखेंगे. Capgras syndrome of delusion of doubles. ठीक है. Patient believes that a familiar person has been replaced by a similar looking stranger. Example, patient goes back home. He enters his drawing room. where his wife is sitting. Wife looks like she has always looked like. Patient does not find any difference in her physical appearance, but the patient has a thought, this woman sitting in my drawing room looks like my wife, is not really my wife, is some other woman who has managed somehow to look like my wife. In this case, the patient has history of fight with his wife. He asks his wife, "Who are you? How did you enter my house? How do you look exactly like my wife? Where is my real wife?" All these are suggestive of Capgras syndrome. Patient of Capgras syndrome fights with a familiar person, friend, family members. ठीक है. Frigoli syndrome में क्या होता है? Kind of opposite to what happens in Capgras syndrome. Patient believes that a familiar person is changing his physical appearance and disguising as a stranger, and that multiple different appearance can be taken. Example: patient has a belief that his wife wants to kill him, and he also believes that wife also follows him wherever he goes. Patient believes that whenever he goes out, his wife follows him. Since he can identify her, so she changes her physical appearance while following him. Wife changes her face as a complete stranger while following him so that husband is not able to identify her. Patient also believes that wife not only changes one face, rather she can change multiple different appearances. Patient of Frigoli syndrome fights with strangers. ठीक है. Syndrome of subjective doubles. Patient believes that he who are living their own separate life. He has many doubles who are living their own separate lives. For example, the patient believes that there are many persons like me who are living their own life in different cities. Syndrome of intermetamorphosis. Patient believes that people can undergo changes in both physical and psychological identity and become an entirely different person. For example, an individual A has a face and different psychological identity. He changes his face and psychological identity and converts into individual B. Individual B has a different face and totally different identity. This is syndrome of intermetamorphosis. Bizarre versus non-bizarre delusions. Bizarre delusion: scientifically impossible and culturally implausible, ununderstandable. For example, patient says, "Yesterday in the evening, three aliens came from Mars. They stole my heart and replaced it with a chip and went away." This is a case of delusion because it is not possible. This is scientifically impossible and ununderstandable. Non-bizarre delusions: false but possible. For example, patient says, "My neighbors are planning a conspiracy against me and want to kill me." In this case, even if it is established as delusion, the belief that the neighbor wants to kill me is possible. The concept of bizarre and non-bizarre delusions is now no longer used in current classification because of lack of objectivity. Bizarre delusion for someone can be non-bizarre for a different person. What is the diagnosis? Frigoli syndrome. 21-year-old girl principally suggests that the college principal is making a conspiracy to delusion of persecution. Delusion of grandiosity and persecution. Patient believes she is most important person in the world. Grandiosity. ठीक है, तो persecution भी है इसमें आगे क्वेश्चन में. ठीक है. Possession of thought. Normally when we think, we have an experience that whatever is going in my mind belongs to me. I am in sole possession of my thought. External person has no control over my thinking. External person cannot interfere with my thoughts. External person doesn't know what I am thinking about. This is the normal possession of thought. Abnormalities of possessions. Thought alienation. Patient feels that others can interfere with my thought process. My thoughts are no longer under my control. Thought insertion. Patient says, "Doctor, something weird is happening with me. I was sitting in my home. I was in my room. I was thinking about cricket, and suddenly a very weird thought came into my mind. And it was not only my thought. My neighbor was using some kind of technology to implant thoughts into my mind." In this case, the patient is experiencing that others are putting thoughts in my mind. This is a disorder of possession of thoughts. Thought insertion. Thought withdrawal. Patient says, "Doctor, yesterday I was sitting in my room and suddenly my mind went completely blank. I couldn't think of anything because my neighbor was using some technology to steal my thoughts. He was withdrawing thoughts from my mind, and my mind went blank. Thought broadcast. Patient says, Doctor, I was sitting in my home thinking about cricket, and then I went outside, and what I saw was my wife was standing outside my door with a ball in her hand. Doctor, she knew what I was thinking about because my thoughts are leaving my head and others can catch them. My thoughts are getting broadcasted. Obsessions. And this patient has same thoughts repetitively. Example, my hands are unclean. This thought comes to my mind repetitively despite trying to stop it. Since this thought is not under control, so obsessions are characterized under disturbance of thought possessions. According to Fish's psychopathology, obsessions are disorder of possession of thoughts. According to Kaplan and Sadok's comprehensive textbook of psychiatry, obsessions are disorders of content of thoughts. Kaplan and Sadok say there are two types of thought disturbances: thought content and thought process. The four options suggest that the examiner is following Fish's psychopathology. Higher mental function, defined as the ability attention higher mental function attention, defined as the ability to attend to a specific stimulus without getting distracted. If you are listening to a lecture, multiple things might be happening in your room, like other students, sounds of fan, noise of the air conditioner, etc. But you are not giving importance to other unnecessary stimuli and you are focused only on the lecture. This signifies attention. Test of attention by digit span test or digit repetition test. Now, okay, attention higher mental function में आता है. Attention is defined as the ability to attend to a specific stimulus without getting distracted. If you are listening to a lecture, multiple things might be happening in your room, like other students, sound of the fan, noise of the air conditioner, etc. But you are not giving importance to other unnecessary stimuli and you are focused only on the lecture. This signifies attention. Test of attention by digit span test or digit repetition test. In this test, the patient has to repeat the digits which the doctor will say. For example, doctor says 37, patient says 37. Doctor says 368, 368, 2754, 2754, 28539. If the patient says 28539, attention is normal. If the patient is able to repeat 5 digits, then his attention is considered as normal. Digit backward test. Variation of digit span test or digit repetition test. Digit forward test is preferred more over digit backward test. Standard textbook says digit backward involves more mental ability than digit forward. For example, doctor says 25, patient says 52. So opposite, backward. Concentration. Concentration, it is the ability to sustain attention. For example, if you are able to listen to this lecture attentively for 30 minutes with proper concentration. Test to check concentration, serial 7 subtraction. Doctor says subtract serial is 7 from 100 at least 5 times. So you say 93, 86, 79, 72, 65. Then memory. 3 different types of memory are tested: immediate memory, working memory. For interval of seconds, use digit repetition test or serial 7 subtraction test. Recent memory, for minutes, hours or days, use 24-hour recall method. For example, calorie intake in 24 hours or what all did you eat in last 24 hours. Remote memory, for years, ask both personal information and historical events. Which school did you go to? When did India win the World Cup? When did Sachin Tendulkar retire? Things that happened 30 years back constitutes the remote memory, and in dementia the remote memory is lost the last. Recent memory is lost first in dementia. Intelligence, general information and calculation skills. For example, name 5 cities of India, name 3 rivers of India, questions on calculation skills, etc. Abstract thinking, higher level of thinking, ability to form concepts and generalization. For example, patient now first time on playing video game the character died after touching the red spot. Second time on playing the video game the character died after touching the red spot. Third time on playing video game the character jumps after seeing the red spot. In this case the person develops concept that the red spot should be avoided. This is abstract thinking. Tests of abstract thinking. Proverb testing. Doctor asks the meaning of a proverb. Doctor says stitch in time saves nine. If the patient says if you take action at right time, you are able to avoid bad consequences later, then the abstract thinking is present. If the doctor asks what is the similarities between chair and table, if the patient says both are pieces of furniture, abstract thinking is present. If the patient says both are lying on the ground, both are made of wood, abstract thinking absent. This is called as concrete thinking. Now judgment, ability to take right decision according to situation. Three types of judgment are there. Test judgment. In this, the doctor gives the patient a test scenario, and based on this, his response, his judgment is tested. For example, doctor asks, "What will you do if you see a house on fire?" If the patient says, "Call the fire brigade," test judgment is intact. If the patient says, "I will try to throw water on it if fire is less," test judgment is intact. If the patient says, "I will jump into the fire," test judgment is impaired. Personal judgment, whether the patient can take right decisions for his life or not. For example, patient is admitted in the ward and doctor asks him, after going out from hospital, "What will you do?" If the patient says, "I will try to find a job, I will try to make money for my family, I will come to hospital every month to meet my doctor," personal judgment is intact. If the patient says, "After my discharge, I will find the CBI agent who conspired with the police and got me admitted into the hospital, and I will take my revenge with the help of America agency," personal judgment is not intact. Social judgment. It is tested based more on observation rather than questioning. We observe whether the patient is behaving socially appropriate manner with the staff, nurses, or doctors. Insight. It is defined as awareness of illness. For example, I have diabetes. I go to the doctor, take my medicine, maintain a regular lifestyle. When I am aware I have illness, insight is present. If he refuses to accept that he has a disease, insight is absent. Now there are levels of insight. Grade 1, 2, 3, 4. Grade 1 is complete denial of illness. Example, patient completely refuses his disease. Grade 2 is awareness of being sick but denying at the same time. For example, doctor asks, "Do you have a disease?" Patient says, "Yes, yes doctor, sometimes the sleep is problematic, but no, I am fine." So aware of being sick but denying at the same time. Grade 2. Grade 3, aware of being sick but attributing symptoms to external or physical factors. Patient says, "Yes, I am hearing some voices and I am not able to sleep, but it is not an illness. Somebody has done black magic on me. That's why these illnesses is happening to me." Grade 4 is intellectual illness. Patient accepts he has an illness, but he does not change behavior according to it. Doctor says, "Do you have any schizophrenia?" Patient says, "Yes, I have schizophrenia," but he refuses to go to doctor or take medication. The patient continues to take cannabis despite being told not to do so. Then grade 5 is emotional insight, highest level of insight. Doctor says, "Do you have schizophrenia?" Patient says, "Yes, I have schizophrenia and I am ready to get the treatment for it." Classification of psychiatric disorder: organic versus functional mental disorders. Organic originates from disturbances of the brain, originates from disturbances from mind, can be demonstrated, cannot demonstrate anything in the brain. MRI of the patient with history of dementia shows gray matter is thinned out, ventricles have become dilated. In schizophrenia, if you do MRI, it is normal. Important information. Now we know even so-called functional mental disorders like schizophrenia is also caused by brain neurotransmitter level. Findings are seen in advanced study like functional MRI. Now psychosis versus neurosis. These are diseases: psychosis versus neurosis. In psychosis, insight is absent, neurosis present. Delusion or hallucination present in psychosis, absent in neurosis. Reality testing is absent in psychosis, present in neurosis. Now, sometimes in patients with schizophrenia may have insight. Even in patient with depression can refuse to take medication and does not accept that he has a problem. Better way of classification is on basis of symptoms. For example, if delusion and hallucination is present, it is called as psychosis. If delusion and hallucination are absent, it is called as neurosis. So delusion और hallucination अगर होंगे तो पक्का psychosis है. Reality testing means whether the patient is living in a real world or imaginary world created by him based on his own experiences. For example, patient has delusion that he is having hallucination, and because of that he starts believing that he is really important person who has made a big scientific discovery. All the governments of the world are after him, and so he has to try to hide in my house. In this case, patient is not living in a real world. He is living in an imaginary world created by him based on delusion and hallucination. Now, classification system. For making the diagnosis, we can follow one or two major classification systems. DSM-5 or ICD-11. DSM-5 is Diagnostic and Statistical Manual of Mental Disorders. Diagnostic and Statistical Manual of Mental Disorders, released by American Psychiatric Association. ICD-11, on the other hand, is International Classification of Diseases, released by WHO. ICD-11 was presented at the World Health Assembly in May 2019. And adoption by member states will come into effect on 1 Jan 2022. As per exams, we follow both ICD-10 and 11. National Institute of Mental Health, NIMH USA, uses which of the following to classify the behavioral disorders? Research domain criterion. ठीक है. Okay. ठीक है. Now this is all about the basics of psychiatry that we need to understand.